today is the start of chemical peeling season. Why don't we just decide on Columbus Day that this will be the official date of chemical peeling season.
Wow! Come on, move it over. That's it, baby. I know you're on a roll.
Hello, welcome. My name is Vivian and welcome back to my channel. This is Skincare My Way. And did you know that we are at the start of chemical peeling season? Yes, there is a season for chemical peeling. Beginning of fall, we're noticing the weather's changing, our skin appears to be drying. But before we go into our very first lesson, because I'm going to teach everybody how to peel in the comfort of your own home safely and effectively. So you're going to get results that will last you longer because you're going to do it safely. But today we're going to talk about the different percentages of glycolic acid. But before we go there, I just want to make one message on my own anti-aging journey. And I want everybody to pay attention, because in this winter, when everybody is going to be aging forward, I am going to be aging backwards. So 2 weeks ago, I set some goals on my own treatments and things that I wanted to accomplish in 2 weeks for my own skin. And one of the things that I'm so excited about this morning is this eye, this right eye. I explained to you in one of my videos that I actually scarred my upper eye here with a margarita glass. And I can tell you today was the first day that I no longer have that slant in my eye. My eye has now lifted up. I am so excited about that. And not only am I excited about that, this 11 is so much better. And one thing that I really rarely ever talk about is, believe it or not, I do have one tiny little wrinkle on my lip. And it has not gone away at all with all the treatments that I've done. I can tell you today it is half gone. I was so excited when I woke up and saw that. But there are other things that I have noticed that are signs of weather changing, and that is this side of my face. When I woke up this morning, there was that wrinkle that goes this way. And again, that is just because of the change of the season. Everything's getting drier now. And what I want to talk about in lesson 1 of learning how to do your own chemical peels is that there are a bunch of glycolics. Okay, we're going to peel with glycolics. I do peel with glycolics or pumpkin enzymes, and we will, in one of these 4-part series, I will talk about pumpkin enzymes. But today I'm going to talk about the percentages of glycolics from 5% to 30%, and which percent would you use at home. And I'm going to show you what I would do for this season and how I have completely changed the way that I perform chemical peels in general. What I do now is really teach my clients and give them the tools they need so they can perform their own chemical peels, because I'm more, instead of going in there and just hitting it with a really high glycolic like a 30 or a 20 and just letting it sit on the face for 2 or 3 minutes, I like to use a lower glycolic over a longer period of time, so you're slow and steady when you're trying to decide what percent of glycolic acid you're going to use for a chemical peel. So how are you going to do this? Do you go to your local esthetician? Do you go to your plastic surgeon? Do you go to your dermatologist? Or do you do this in the comfort of your own home? I have always taught my clients how to do their own chemical peeling because of the technique that I like to use. It's just a more safer treatment, and your results will last you a lot longer than just kind of slamming the skin with a very harsh chemical and then going through the whole healing process. Kind of stresses the skin out. Well, I'm going to show you my technique, and I am going to put this in lesson 1. But in lesson 1, we're just going to go over glycolics because that is my drug of choice. I have been playing with glycolic acids for about 30 years. My husband made me my first 7% glycolic acid, and all I used was glycolic acid, and it removed all my acne, period. 7%, it took me 2 months. I was completely cleared, but I was addicted to glycolic acid, and that is a whole nother story. But today we're going to talk about all the percentages that we have and why we use lotions. Sometimes I will use a cream, but I use lotions, and I do sell my clients more the lotion. So we go 5, 7, 10, 12, 15, 20, 30. Once in a while we'll make a 40 for a physician if they ask. Anything above 15 we only sell to medical professionals. We like to keep all the other ones for if you're working at home. But let me tell you, even in a medical office, there are better ways to perform a chemical peel. Here is a 5%. This 5% is what I'm going to use. It's going to take me this much 5% to get a 30%. This is 30% chemical peel. Okay, so it's going to take me 5% glycolic acid to use over, let's say, 4 or 5 hours, but that will give me a 30%. It will be more comfortable. I will have more control of the acid, and I will get an overall better result than slamming my skin with 30% glycolic acid. This is the first lesson I want everybody to understand, is you can take a 5, a 7, or a 10% glycolic acid, and you can do a chemical peel. It is not about the percentage of glycolic acid. It is about the length of time that you keep that glycolic going. As long as glycolic acid is wet and moist on your skin, it will continue to work. And this will give me an incredible chemical peel. Now, I only peel maybe once a year now that I'm almost 70 years old. Since I want to be here with you and train people, I am going to do a really nice chemical peel on myself using 5% glycolic acid. Your skin is so sensational. Your skin really dictates when you have had enough. It will say, I've had enough, and you will know it because you will feel it. Just like if you slammed this 30% on your face and just let it sit there, it would be like a fireball. I used to always tell my clients it's like fire ants that are just like all over your face, just like beating down on you, or a really, really bad sunburn. So you go through this stressful situation. Most people go through a very stressful situation when you're slamming their skin with some kind of acid. But there are very few, and I have had those clients that literally feel almost nothing, even with a 30%. Now, I don't know if they were lying to me and they just wanted me to leave it on longer, but I had some clients that could leave this on even 10 minutes or even longer. But anyway, that is your first lesson. The reason we do not use gels is because they dry up too fast, and you would have to use too much of the gel in order to get a particular result. And with a lotion, I feel like I have more control over it. With a cream, when I'm using creams, they're kind of heavy and thicker. So if I need to get it off, it's kind of a little bit more difficult to get off. And one more thing I do want to talk about is when you come to the end of your peeling session, whether you're going to hit it hard for a short amount of time or whether you're going to take the time and you're going to let it go even a couple hours. Like I'll do this for like maybe 4 hours tomorrow, and I will just keep on reapplying every 15 minutes. I will come to the end where my skin will say, where I can't handle it anymore. And at that point, I can either shut the glycolic down or leave it on a little longer. But what you use to shut it down is original facial wash. This is an acid. Facial wash is an alkaline. You put them together, it shuts down the acid almost immediately. It's just the craziest thing. So we'll see whether I keep it on or turn it off. But anyway, I hope you learned a lot today about glycolic acid. And I will be back tomorrow because I am going to show you how I do this chemical peel. Okay, that will be my lesson too. I'm really excited to start this series on chemical peeling and how to do it safe and effectively in the comfort of your own home to get long-lasting results. I will talk to you tomorrow. I will be back because we are going to start the chemical peeling process from beginning to end. Thank you for watching. I will talk to you soon. Bye for now.